Despite claims from the President of the United States that we are rounding the corner, the U.S. has smashed its previous record for daily coronavirus infections. Nearly 90,000 Americans were diagnosed with the disease Thursday, bringing the country's total closer to 9 million since the beginning of the health crisis. Meanwhile, healthcare workers are filing a lawsuit against the Occupational Safety and Health Administration, accusing OSHA of failing to keep them safe. Thursday, the CDC estimated more than 192,000 healthcare workers have been infected with the coronavirus, and more than 700 of those have died. For more on this, we are joined by Dr. Bob Lahita. He's a professor of medicine at New York Medical College and chairman of medicine at St. Joseph University Hospital. Dr. Bob, so first of all, the president's son, Donald Trump Jr., claimed that COVID-19 deaths have dropped to almost nothing. This when we just saw a record-breaking number of infections and a day in which 1,000 Americans, 1,000 of our friends and neighbors and colleagues and loved ones succumb to the virus. And now you've got this lawsuit that's been filed against OSHA. Do you think that there should be some sort of standard when it comes to keeping healthcare workers safe?
Yes. Okay, Vlad, thanks for asking that question because, we in healthcare are all concerned about this second surge, if that's what we're going to call it. There have been over almost 10,000 OSHA complaints from various unions, including the union or Federation of Teachers. We're really concerned, and we are not seeing the kind of mortality or deaths that we saw back in the early spring. Now, that may have several reasons. The reason could be that people who are vulnerable, of advanced age and have comorbidities are wearing masks and social distancing. We know that young people survive at the rate of 99.98%, whereas people over the age of 70 succumb fairly well. 94.6% of elderly people survive. So there's that 5% that don't. But we are seeing an uptick in this area of New York and New Jersey, an uptick of cases that come into the emergency room. Some of them are admitted, and those who are admitted, we're trying to keep off of ventilators and out of the ICU. Vlad?
So, Doctor, the United States has the largest number of total recorded coronavirus cases. Can we just revisit sort of what we're not doing right here? It's great that the mortality rates are dropping, but our cases continue to skyrocket. What's going on?
Yeah, well, first of all, Anne-Marie, you realize that when you get infected, you do not know whether you're going to be one of the people who dies. And that is ageless. There's no age range that I can say, well, if you're 40, you're not going to die. You can be 20 years of age and die from this virus. We simply don't know what the pre-existing factors are, other than we know that comorbidities and advanced age are major factors. But anyone can get this infection and die. So the fact that the numbers are going up means that people aren't mitigating. They're not wearing masks. They're not social distancing. I don't advocate a shutdown of the country as they are doing in Europe. But I do think we do have to be careful, and we have to wear our mask, and we should not be close together at indoor gatherings, bars, tattoo parlors, even gyms, and other groups or other places where people are shoulder to shoulder yelling and shouting at each other, and they're not wearing any masks. It's a simple thing. Wear a mask and socially distance. Anne-Marie?
We're also entering the flu season, Dr. Bob. How could the flu vaccine help mitigate some of the burden placed on an already overextended healthcare system?
Well, our biggest problem in the emergency room is when someone comes in intractably coughing with a high fever, muscle aches, perhaps nausea and vomiting. We have to ask ourselves now, which we didn't in the early spring, do they have the flu? Do they have COVID? It helps if they've lost their sense of taste and smell. That's a good predictor of the fact that they're COVID positive. We can't be sure, however. The good news is we can do a rapid flu test to eliminate influenza A and B as a possibility. But it still it's still a bit of a conundrum for people on the front lines trying to figure out, what does this patient have? Now, influenza is not an innocuous disease, and I advocate that everybody be immunized as soon as possible because that makes life a little easier. And remember, children succumb to the flu more than they would of COVID-19, and that's very, very important to remember. Children get the flu and don't do well. Vlad?
Yeah, that's really good to remember. We are all sort of focused on COVID, but the flu is also a threat, and we have options with the flu, so you should take advantage of it if you can. Dr. Bob Lahita, thank you.
Thank you.